You there, Mark?
Oh, yeah, good afternoon. Thanks for taking my call. I just wanted to share with you a little bit of insight. I'm a nurse in a Melbourne emergency department, and I'm not going to name which hospital it's at, but it's been pretty well covered that emergency departments are under, some pretty trying times at the moment, and that is true. But what's not being talked about at the moment is, at the moment in the hospital I work at, we're getting about probably 20 patients an hour fronting up to emergency. And what they're here for is they've been recently vaccinated. They're experiencing a few side effects like chest pains and so on. And, they're concerned, and it's putting a lot of pressure on us to deal with actual, severe cases. Now, what we've been doing is setting up, sort of mass triaging, where we might have 6 or 7 nurses triaging at once. We do a quick ECG test, blood pressures, temperatures, that sort of thing, just to establish a few quick facts. We'll then give the patient the option to see a doctor, or if they're comfortable with, their ECG results, they're free to go on their way. But the more and more people that are getting vaccinated, the more pressure it's putting us under. And, it's a sensitive subject. We're not really meant to talk about this.
Well, it's difficult to know what the alternative, Mark, because you don't want to tell people not to present at the emergency department if they're unwell. But I guess if I'm reading you correctly, it's just perhaps only present if it is an actual emergency. Oh gosh, I feel you don't want people to, people are not good judges of whether they are needing medical treatment or not. Your GP would always be the first step if you don't feel sick enough that you need to call an ambulance. Mark, thank you. Appreciate your call. Let's check news headlines now. Jordan